Le Nissan Kick-Play 2025 a beaucoup de plus. Apple CarPlay intégré pour jouer vos tunes préférées, des fonctions avancées de sécurité, un rendement énergétique remarquable, puis même la petite odeur de char neuf qu'on aime tant. Tout ça en plus pour moins. Le Nissan Kick Play 2025 est le véhicule neuf le plus abordable au Québec. Achetez-le à partir de seulement 22 774 $, incluant un rabais à l'achat comptant de 2 600 $. Profitez de cette offre avantageuse chez votre concessionnaire dès maintenant. Jusqu'au 2 mars, des conditions s'appliquent. Détails chez Nissan.
We begin this third hour of the program talking about xylazine. It's known as the zombie drug, and it's increasingly being detected in Quebec following its rise in the U.S., often mixed with other drugs like fentanyl. It significantly heightens the risk of overdose. In 2023, it was found in 1% of tested drug users in Quebec, with many unaware of its presence. Let's now go to Adam Zivo, National Post columnist and the director of the Center for Responsible Drug Policy. Adam, welcome back to the program.
Thanks for having me back. Good morning.
You have been on the front lines of the drug crisis in this country for quite some time. Why don't you tell our listeners how distressing it is to hear that xylazine is becoming more prevalent in Quebec?
Well, the problem with xylazine is that it's not something that we can easily reverse, right? So most people are aware of Narcan, and Narcan essentially is used to reverse opioid overdoses. But xylazine is an animal tranquilizer. You know, it's historically been used for cattle. So if you give someone Narcan, you know, it's not going to do anything because that's for a totally different kind of drug. And the problem with xylazine is that as a tranquilizer, it leads to respiratory depression, which significantly increases the risk of overdose if you have it mixed with an opioid like fentanyl. Because the main reason why people die of an overdose when they're using opioids is because essentially the respiratory system just stops working. So when you have xylazine mixed into your drug supply, suddenly the risk of overdose goes up substantially. Now, the problem is that xylazine has been increasingly found in our illicit drug supply since 2019, and it really skyrocketed just after the pandemic. However, for whatever reason, it's predominantly been found in Ontario. In fact, not a lot of it has been found in BC even, and very little of it has been found in Quebec, but we don't know if that's going to change. And so it's concerning to see that in Quebec these numbers are increasing, because that will mean that more Quebecers are going to die.
Now, it's called the zombie drug, I imagine with good reason. I have seen videos online of people that are acting like zombies a bit, like, and I'm told they're using the zombie drug, right? So can you just tell our listeners about that aspect? And have you seen with your own eyes the effect, this zombie effect on people?
Well, the thing is that there are all kinds of drugs that will leave people acting like zombies, opioids being one of them. The reason why xylazine is called a zombie drug, though, is that it tends to create these horrific infections that leave gaping wounds in people's bodies.
Oh, my goodness.
Often leading to amputation.
Jeez.
Right. It's horrific. I haven't witnessed this personally because I don't do clinical work. So I write about these issues, but I'm not always in the neighborhoods where this happens. But the whole thing has been very well documented. And when you take someone who is already homeless, who is already addicted to drugs, and then you add on top of all of their other hardships, you know, living with big gaping wounds in your body, I mean, that significantly worsens health outcomes. I mean, because not only are these wounds, of course, really bad for your health, as anyone would imagine, but it also significantly increases the risk of infection.
So, how do you counter this, Adam? Like, what's the proper way to counteract, this growing trend and xylazine becoming more prevalent here?
I think that's a hard question to answer. I think one of the ways that we could do that is to control the drug supply a bit more effectively by creating barriers to the acquisition of xylazine. Because as of now, xylazine is not a controlled substance because it's often used by veterinarians. So it's very easy to get and it's very cheap. And that's why it's so often mixed into illicit drugs, because you're adding bulk, you're expanding your drug supply, you can make more money. However, if you were to control the substance, you would have to do that across a number of jurisdictions because, for example, if Canada decided to control xylazine but the United States didn't, then it'd be very easy just to smuggle xylazine from the U.S. to Canada or vice versa. So I think there needs to be an international conversation about how regulatory reforms can be implemented across a number of countries to ensure that xylazine is more difficult to acquire.
I've seen some groups here in this city, Adam, advocating for, more testing of drugs. Like before you use drugs, test them. You can go to various advocacy groups and they can test your drugs to see if it's pure or not, or if it contains xylazine. What do you say to that when you see certain advocacy groups pushing for more testing as a solution here?
Yeah, I think that's a great idea. I mean, I think that helping people understand what's in the drugs that they're using certainly keeps them safer and reduces their chance of death. And the problem here is that xylazine test strips are relatively expensive. They're about $3.50 each. And if you are a drug user who's existing on the margins of society, you don't have a lot of money. So that can be quite expensive for you, especially if you're using multiple times a day. So I think it makes a lot of sense to have public funding for increased access to xylazine test strips. And I think that that's a harm reduction intervention that most people can get on board with. I don't see why anyone would disagree with it, to be honest.
We're with Adam Zivo, the director of the Center for Responsible Drug Policy. We're talking about xylazine and how is it becoming increasingly detected here in Quebec. Adam, if you look at other jurisdictions, you mentioned Ontario, right? If you look at Ontario, if you look at the United States, if we were to continue down the same path in Quebec that we've seen in other jurisdictions, where does this end up for us? What would we be seeing on our streets given another year or two?
I mean, more disorder and more deaths, right? The good thing about Quebec is that Quebec has been much stricter when it comes to opioids. For example, there hasn't been as much opioid overprescribing in Quebec as there has been in other jurisdictions, and that means that there are fewer drugs floating around in Quebec that hook people onto the ladder of addiction and eventually move them up to using fentanyl. So I think that so long as Quebec maintains a relatively strict approach to drug policy, that it may avoid seeing some of the grievous harms that we've seen on the West Coast and parts of Ontario.
Adam, you brought up fentanyl there, and I want to know, how do you see the current fight against fentanyl producers in this country? Obviously, Donald Trump threatened those tariffs. He brought up drugs as one of the reasons why he's threatening tariffs with Canada. We have seen multiple labs in this country shut down, super labs shut down. How is that battle going, the battle against fentanyl across the country?
Well, we're losing it because we're not taking it seriously. So the problem here is that fentanyl started flowing into Canada and the United States around the mid-2010s. And then ultimately, in response to U.S. pressure, China banned the production and export of fentanyl in 2019. But what they did instead is that they maintained tax incentives that allowed domestic producers to export fentanyl precursors, basically the chemicals that you use to make fentanyl. And 80% of these precursors are unregulated. So it's very easy for Canadian criminals to acquire these precursors and make fentanyl in our country and sell it to our people and kill them. Now, of course, there's that 20% that's illegal, but it's trivial to smuggle that into Canada from China because we basically have no port policing. In the Port of Vancouver, where a lot of the stuff comes through, we have absolutely zero dedicated police to check shipping containers coming through. So only 1%, less than 1% of shipping containers are checked. Now, in contrast, the Port of Seattle, which sees similar shipping volumes, has 100 dedicated officers and 50 support staff. So I don't understand how it is that years into this crisis, no one's thought to increase our policing in our ports to ensure that illicit drugs and precursors don't come into our country.
That juxtaposition there between Vancouver and Seattle certainly is staggering. Adam, listen, we've run out of time. It's always great to catch up with you and to talk about what's happening with drug use in this country. Come back real soon, okay?
It's a pleasure to be here. Thank you.
Adam Zivo, National Post columnist, also the director of the Center for Responsible Drug Policy.